You know what nobody's talking about right now? The fact that millions of Americans who depend on Social Security, SSDI, and SSI are sitting at their kitchen tables this week wondering if they're actually getting another $1,400 check. And here's what's really going on. The rumors started flying across Facebook groups and email chains faster than wildfire. People are calling their local Social Security offices. They're checking their bank accounts 3 times a day. And I get it. When you're living on a fixed income of $914 a month from SSI, or scraping by on disability payments that haven't kept pace with inflation, an extra $400 isn't just money. It's breathing room. It's catching up on the electric bill. It's fixing the car that's been sitting in the driveway for 2 months. But here's the truth that the clickbait headlines won't tell you. The federal government hasn't authorized any new stimulus payments for 2025. Not yet, anyway. However, and this is critical, there are actual programs and benefit adjustments happening right now that low-income recipients need to understand, because leaving money on the table when you're on a fixed income isn't just unfortunate. It's devastating. Let me be crystal clear with you from the start, because I'm not going to waste your time with fluff or clickbait nonsense. I'm going to walk you through exactly what's happening with your benefits, what changes are coming down the pipeline, and most importantly, what you need to do right now to make sure you're not missing out on money that's rightfully yours. And I'm going to do it in plain English because the government has a way of making simple things sound like you need a law degree just to figure out if you're getting a cost of living adjustment or a kick in the teeth. So let's start with the elephant in the room. Is there a new $1,400 stimulus check coming for Social Security, SSDI, and SSI recipients? The short answer is no. There's no federally approved stimulus payment sitting in Congress right now with your name on it. But here's where it gets interesting, and this is where you need to pay attention because the devil is always in the details. While there's no new stimulus check per se, there are several legislative proposals floating around Capitol Hill right now that could put significant money back in your pocket. And some states, yes, you heard me right, some individual states are actually sending out their own relief payments to low-income residents, including folks on Social Security and disability benefits. Now, I want you to understand something fundamental about how our government works, especially when it comes to your benefits. Every year, the Social Security Administration is required by law to calculate what's called a cost of living adjustment, or COLA. This isn't some generous gift from Uncle Sam. This is supposed to be a mechanism that ensures your buying power doesn't evaporate because a gallon of milk that cost $3 last year now costs $5. For 2025, the COLA increase came in at 2.5%. Now, I know what you're thinking. 2.5%? That's it? When my grocery bill has gone up 30% in the last 3 years? And you're absolutely right to feel that way, because the formula they use to calculate COLA is based on something called the CPIW, which is the Consumer Price Index for urban wage earners and clerical workers. Let me repeat that. They're calculating your cost of living adjustment based on what working-age city dwellers are spending their money on, not what seniors are actually paying for. You're spending more on health care, prescription drugs, and housing, but they're measuring the cost of things that have nothing to do with your actual expenses. But here's what that 2.5% increase actually means in real dollars for you. If you're receiving the average Social Security retirement benefit of about $1,007 per month, that COLA bumps you up by roughly $48 a month. For someone on SSI getting the federal maximum of $943 per month, you're looking at an increase of about $24 per month. Now, I'm not going to sit here and tell you that's life-changing money, because it's not. But it is money that's already hitting your bank account in 2025, and you need to understand that this is separate from any potential stimulus or relief payment that might come down the road. Here's where things get really important, and I need you to stay with me because this could mean hundreds or even thousands of dollars that you're entitled to, but might not be claiming. The Social Security Administration has a terrible track record of proactively informing beneficiaries about programs they qualify for. There are supplemental programs, state assistance programs, and even federal benefits that you might be eligible for right now today that nobody's bothering to tell you about. Let me give you some examples that are actually putting money in people's pockets. Medicare savings programs are one of the most underutilized benefits in this country, and it's absolutely criminal how many people don't know they exist. If your income is below a certain threshold, and we're talking about $1,949 per month for an individual or $2,080 for a couple as of 2025, you could qualify for help paying your Medicare premiums, deductibles, and co-payments. That's not chump change. We're talking about saving $174.70 per month on your Medicare Part B premium alone, which over a year is $2,096. That's more than your imaginary stimulus check, and it's real money that stays in your pocket every single month. Then there's the Supplemental Nutrition Assistance Program, what most people still call food stamps or SNAP benefits. Now, I know there's a stigma around this program, and I've talked to countless people who tell me they worked their whole lives and they don't want handouts. Let me tell you something. You paid into this system for 40, 50, maybe 60 years. This isn't a handout. This is using a program that exists specifically to help people in your exact situation. If you're on SSI, you're almost certainly eligible for SNAP benefits. If you're on Social Security or SSDI, depending on your income and expenses, you might qualify too. We're talking about an average benefit of $195 per month for seniors. That's real food on your table. Now let's talk about what's actually happening in Congress right now, because there are proposals on the table that could affect your bottom line. There's been ongoing discussion about a fourth stimulus check specifically targeted at seniors and people with disabilities. I want to be honest with you, the likelihood of this passing in the current political climate is not great, but it's not zero either. What's more realistic is targeted relief that comes through other mechanisms. Some legislators are pushing for an additional COLA supplement, essentially a one-time boost to Social Security payments to account for the fact that inflation has outpaced the standard COLA calculations for the past several years. Others are proposing expansions to existing programs, like the Low-Income Home Energy Assistance Program, or LIHEAP, which helps with heating and cooling costs. And here's something that's actually happening right now that you need to know about. Several states have passed their own stimulus or relief programs specifically for low-income residents. California, for example, has had multiple rounds of Golden State stimulus payments. Colorado, New Mexico, and Minnesota have all sent out various forms of relief checks to eligible residents. If you live in one of these states and you're on Social Security, SSDI, or SSI, you might have already received a payment, or you might be eligible for one. But here's the kicker. You often have to apply for these programs. They're not automatic. The state isn't going to knock on your door and hand you a check. You have to know the program exists, you have to know you're eligible, and you have to go through the application process. This is what drives me absolutely crazy about the way our system works. The people who need these programs the most are the least likely to hear about them. You're not sitting around reading state legislature updates. You're not following budget appropriations committees. You're trying to figure out how to make your Social Security check stretch another week until the next one hits. Meanwhile, there's money sitting in state coffers earmarked specifically to help people in your situation, and it's going unclaimed because nobody's doing the basic work of informing you that it exists. Let me talk about something else that's critically important, and that's understanding the difference between Social Security retirement, SSDI, and SSI, because these programs have different rules and different benefit structures. Social Security retirement is what you get if you worked and paid into the system for at least 10 years. The amount you receive is based on your earnings history. SSDI, or Social Security Disability Insurance, is for people who have a qualifying disability and have worked enough to earn sufficient work credits. SSI, or Supplemental Security Income, is a needs-based program for people who are elderly, blind, or disabled and have limited income and resources. The reason this matters is that eligibility for supplemental programs often depends on which benefit you're receiving. For example, if you're on SSI, you're automatically eligible for Medicaid in most states. If you're on SSDI, you get Medicare after a 2-year waiting period, but you might not qualify for Medicaid unless your income is low enough. These distinctions matter when you're trying to figure out what additional help you can get. And here's something that absolutely boggles my mind. There are people out there who qualify for both SSDI and SSI, what's called concurrent benefits. And they're only receiving one because nobody told them they could apply for both. If your SSDI payment is below the SSI federal maximum, you can get SSI to bring you up to that level. That's potentially hundreds of dollars a month that you're leaving on the table. Now, let's talk about what you should actually be doing right now, today, to make sure you're maximizing your benefits and not missing out on money. First thing, and I mean this literally as soon as this video is over, you need to create a My Social Security account at ssa.gov if you don't already have one. This is free, it takes about 10 minutes, and it gives you access to your complete earnings record, your projected benefits, and your current payment information. You can see exactly what you're getting and why. You can also use this account to report changes in your circumstances, request replacement documents, and manage your benefits without having to spend 3 hours on hold with the Social Security Administration. Second, you need to contact your local area agency on aging. Every state has these agencies, and they're specifically designed to help seniors navigate the maze of available benefits and programs. These folks know about programs that even I don't know about because they're hyper-local. They can tell you about property tax relief programs, utility assistance, free or reduced cost prescription drug programs, meal delivery services, transportation assistance, and a whole host of other resources. And here's the best part, their services are free. They're funded by the Federal Older Americans Act specifically to help people like you. You can find your local agency by calling the Elder Care Locator at 1-800-677-1116 or visiting eldercare.acl.gov. Third, and this is huge, you need to do a benefits checkup. There's a website called benefitscheckup.org that's run by the National Council on Aging. You go to this website, you answer some questions about your age, income, location, and expenses, and it generates a personalized report of every single benefit program you might be eligible for. We're talking federal programs, state programs, local programs, utility assistance, prescription drug help, everything. I've seen people go through this process and discover they're eligible for 6 or 7 different programs they had no idea existed. That can add up to thousands of dollars a year in assistance. Fourth, if you're struggling to make ends meet, you need to talk to a Medicare counselor about Medicare savings programs and extra help with prescription drug costs. The Extra Help program, also called the Low Income Subsidy, can save you thousands of dollars a year on your Medicare prescription drug coverage. We're talking about help with premiums, deductibles, and co-payments. And just like the Medicare savings programs, way too many people who qualify aren't enrolled because they don't know it exists. Here's the bottom line, and I want you to really hear this. There is no magic $1,400 check coming in the mail next week. Anyone who tells you there is, anyone who asks you to pay a fee to get your stimulus check, anyone who needs your Social Security number or bank account information to process your payment, that's a scam. Hang up the phone. Delete the email, block the number. But just because there's no new stimulus check doesn't mean there isn't real money available to you right now through existing programs. The problem isn't that the help doesn't exist. The problem is that our system is designed in a way that makes it incredibly difficult for the people who need help the most to access it. You have to be proactive. You have to ask questions. You have to advocate for yourself. And I know that's not fair, especially when you're dealing with health issues or mobility challenges, or you're just plain exhausted from trying to survive on a fixed income. But the alternative is leaving your money on the table, and I'm not going to let you do that.